Hello, um, my name is Tinemishe Moyo. I'm going to be uh, presenting on mental health and social policy in relation to social work practice. So I'm going to begin by defining what is mental health. Um, Mental health can be defined as a state of well-being where an individual is able to recognize the abilities, their skills, the knowledge, what they are capable to do, and be able to use them in their day-to-day life. It also encompasses the ability of a person to cope with life stresses, whatever kind of stresses they encounter, be it work-related stress, family-related stress, financial related stress. They should be able to cope and remain functional. Also, the ability to work productively. When someone is working, we expect to see results. So, a person who is in a state of mental well-being should be able to work productively. They should also be able to contribute meaningfully to communities in which they exist in. And then basic definition of social policies could be these are frameworks that are normally implemented by governments with a overall goal of improving the social welfare of individuals and communities by addressing issues such as economic inequalities, health, health and healthcare disparities, education, gender disparities. The list is long, but basically those are the definitions of mental health and social policies. And then we move on to the intersection between mental health and social policies. Mental health issues are largely related to various social determinants or most root causes of mental health social determinants that include things like economic instability, education, that is lack of education thereof, social and community context, health and healthcare, the neighborhood and built environment in which people reside. Conditions such as poverty and social exclusion can also adversely affect mental health. Hence, there is need for targeted social policies to support at-risk populations. You realize that people from studies that have been carried, people from lower socioeconomic status are linked with higher rates of mental health disorder, thereby reinforcing the importance of comprehensive strategies into broader social safety nets. Mental health is becoming a critical area of focus within social policies worldwide due to its intricate links to socioeconomic factors and community well-being. Most people who are having mental health problems are a result of social determinants. So social policies are now becoming more and more popular in mental health to try and address these social determinants so that we reduce cases of mental health. Policies are mostly aimed at fostering social connections and can act as protective factors against mental health illnesses. Social policies can work in two categories. We can categorize them into two parts. The first part is the preventative one. In this case, we are trying to prevent mental health issues, or to make sure that people do not experience mental health issues by addressing the social determinants before they have an influence on the mental health of people. For instance, we might notice that people are having mental health issues because of poverty, maybe issues of lack of income, inaffordability of healthcare services, education, and any other basic needs that people might need, maybe an employment. So social policies come in to provide and address these issues by providing services that addresses issues of poverty, maybe in terms of funding for creation of income generating projects, so that people have a consistent and sustainable source of income to cater for their basic needs in life. Provide services like affordable or subsidized healthcare services, affordable education services, creation of employment opportunities. These are all high contributors to mental health. So this will prevent people from getting into mental health, having mental health issues. Then the other part is the protective one. In this category, we are saying the inevitable has already happened. People have already been affected by the social determinants, by poverty, by unavailability of income or inadequate income, homelessness, maybe unavailability of water and safe sanitation facilities, and any other issues, and they are already affected mentally. So we are now social policies are coming in now to respond. This is now responding to the situation that is at hand, by making sure that communities or individuals have access to healthcare services to address the problems that they already have. They have access to, maybe if it's housing when they are homeless, to address the situation, maybe providing of adequate and proper housing, counseling services, proper ablution facilities, and provision of safe water facilities. So they can come in preventative, they can be preventative, or they can be protective. Either way, they are helping reduce cases of mental health by improving the social well-being of communities. Social policies related to mental health encompass a wide range of legislative and administrative strategies designed to influence the mental well-being of individuals and communities. Their major goal is to address the social determinants of mental health, and aiming to mitigate disparities in mental health outcomes across diverse population. The focus of social policies in the context of mental health is fundamentally anchored on improving access to mental health services, thereby promoting mental well-being. Social policies can be as localized as local communities. They can start as low as within a local community. Maybe an example could be a school could have its own local school policy to address issues that are localized within their communities, maybe of children that are failing to come to school because they can't afford the tuition, maybe they don't have adequate food, or maybe they have to walk longer distances to access education. So schools may come up with their policies to address such social issues. We have the BEAM projects, where the communities come together and put together resources to assist those children who cannot afford tuition, the school feeding programs. Those are localized policies. We have policies that are crafted at national level, that are implemented across the whole nation. We have regional policies. We also have global policies that address issues to do with mental health. Maybe at global level, I just want to give an example of the Sustainable Development Goals. The Sustainable Development Goals, if you look at them, most of them are there to address issues of mental health that are caused by social determinants. If you look at the goals like no poverty, zero hunger, reducing hunger, and good health and well-being. We have reducing inequalities, gender equality, industry and innovation, economic growth. All those, if you look at them, these are the issues that, if not addressed, can end up resulting in mental health. So if poverty is reduced, gender inequalities are reduced, there's economic growth and industry and innovation, it means there's high creation of employment, and thereby people can generate income and can be able to have a stable life where they can afford and access basic needs that they need and basic services that they need in life, as we have realized that most of these social determinants like poverty, inequalities, economic instability are great sources of stressors. So even the global community has a commitment on social policies that addresses issues to do with mental health. Previously, most of the social policies that were being implemented by government, some of them were a bit ambiguous, some of them were a bit too broad, all-embracing, not really targeting unique needs that some special groups or some specific populations of people would need. For instance, when the social welfare policy, I'm sure most of the countries have the social welfare policy. The social welfare policy was just there to improve the welfare of vulnerable populations, but it was just a general policy that addresses all vulnerable in one bunch without addressing or specifically targeting the specific needs of individual groups. For instance, within implementing the programs, we realized that some of the groups, like let's say the disabled, could not access some of the services. Maybe children, maybe women, maybe the elderly. And as time goes on, they realized that they had to establish or craft policies that would pay specific attention to unique needs of each individual group. Then we began to have policies like the gender policy that addresses issues to do with women, issues to do with menstrual hygiene management, maternity leave, equal pay for both men and women, and we also had, I don't know whether in other countries they had that, but in my country we had what was called the affirmative action, that was meant to bring a balance between men and women, in that women would not excel very much in terms of education because of the gender roles that they have. So whilst men or boy child had adequate time to study, girls, when they get home, they had to do some household chores like cooking, washing the dishes, cleaning the house, whilst boys had ample time to just focus on their education. So boys would excel more in their academic compared to girls. So the affirmative action was to try to bridge that gap by saying, by dropping a little bit the bar for girls. Like for instance, is if for a particular degree or for a particular diploma there is a qualification or a certain points that are required, women could be allowed to get into that with a little bit lower points so that they catch up to bridge up the gap. So these are some of the social policies, because women were having mental health, because at the end of the day, a woman who knew that she's very capable of doing what the other boy child would do would fail to achieve, not because they can't, but because they didn't have the equal chance that the boy had. So these came into address the specific needs of specific groups of people. We now have the gender policy, we have the child protection policy that specifically addresses the needs of children, we have the policy for the disabled, we have the policy that addresses the elderly with their specific needs that might differ from the other age groups. So these are coming in to reduce the mental health, because we don't have a one size fits all when it comes to social policies. We don't have a one size fits all jacket, so they need to be crafted within the context of the community or the region or the age group, whichever that we are going to use to demarcate them, the social policies. I've already alluded to specific population, particularly marginalized groups, face unique challenges that demand tailored policy responses, e.g. women, disabled, and people with children. In various contexts, for example, in Uganda and Ghana, the mental health care systems struggled to cater for the specific needs of women and children, illustrating that there are broader imperative for social policies that specifically addresses mental health needs of these demographic groups. And then also moving on, would realize that most of the people that are affected by mental health, most of the time they do not have one problem or one social determinant that is influencing their mental health. You'd realize there's a multiplicity of problems that are contributing together. Like people might have a problem of low income. They don't have income adequate to cater for their for their basic needs, day-to-day needs. They might have also they might not have access to healthcare services. They might not have access to education. They might live in a hard-to-reach area where it's very difficult to access services. So all these problems, they overlap with each other and contribute to the severity of mental health issues. So it is very key that when policies are being implemented, there is need for a holistic approach, that is engagement of various stakeholders, key stakeholders, so that they all bring their different expertise and services they provide, so that communities or individuals receive a comprehensive package, whether it is in terms of hardware or software, that is information, knowledge, capacity building, or something that is material, something that is tangible. So it is ideal that when policies being implemented, for them to be effective, there is need of involvement of a variety of key stakeholders. I remember during the COVID era, because the resources were limited, people were going through so many challenges because of the restrictions that were there. People were going through a lot of economic hardships. They could not afford basic products like food, sanitary and other things that are key for every day-to-day life, and this resulted in mental health problems. People could not access water, clean water, and also because of these, we ended up having high cases of gender-based violence. So we had to come up together as different stakeholders, instead of one stakeholder going the social welfare department, sending the social welfare department to attend to the needs of the communities. We came together as departments. The Minister of Women Affairs addressing gender issues, with the Minister of Health catering for the health issues, like we're having a mobile clinic, but with a variety of services. Since the communities could not come for the services, we had to take the services to them, but not individually, but as a group, as a team. We went there to provide the services at one go, so they had a chance to come and access all services in one place, and it helped in reducing mental health issues. And also, because of the restricted resources, we managed to provide services to a bigger number of people, and it improved the well-being of communities. And then also, in light of recent global events such as the COVID-19 pandemic, mental health policies are being reshaped to account for new challenges. We are saying our environment and the way we live is constantly changing, it's constantly evolving, thereby the social policies need also to be evolving as we evolve, so that we shape them and remodel them to fit into the new issues that we are currently experiencing in the world. The COVID pandemic was a learning point, was a turning point in terms of social policies and mental health, as the pandemic highlighted the significance of social determinants in mental health, and has catalyzed changes in legislative frameworks, underscoring the urgent need for mental health to be a primary consideration in public health responses. We need to be flexible. You might realize what was relevant 5 years ago might not be relevant now, because of things that are constantly changing, perspectives, the life, technology advancement, and urban development. Things are changing, so we really need to make sure that our social policies are also moving with time and remain relevant. I'm just gonna give a few examples of social policies that seems maybe common across the globe. I'm not going to be able to list all of them, but just a few of them that I think are common. You'd find them everywhere you go. I'm going to look at the health policies. I'm sure if you go in any country, anywhere, you would find that they have a health policy, and this entails funding of mental health services and determines access to basic healthcare services for the vulnerable members of the community. In my country, I come from Zimbabwe, by the way, even though now it doesn't really live up to what it was when these policies were put into place, because of issues to do with corruption, and the health facilities are slowly crumbling down. But however, when the policies were put in place, there were issues like free health access for all children under 5 years, free maternal health for all pregnant women, free medical services for the elderly, that is all over the 65 years of age. This was to promote universal health care, mental health, and parity laws ensure that mental health services are acceptable and affordable, reducing untreated chronic diseases and mental health illnesses. And then we also have the economic policies, as I have already alluded to, that poverty and unemployment are a major source of stress, and it increases the risk of mental health issues like depression and anxiety. So economic policies can buffer this risk, and these address issues around income and support minimum wage and employment affecting financial stability. We also then have the housing policies. We have realized that if you go to many countries, you'll see, especially, I've realized that even in development countries, the issue of homelessness is a problem, is a big challenge for many people, and access to stable and affordable housing is crucial for mental well-being. As we see people who live on the streets, they end up engaging in they end up engaging in drugs so that they can be able to build resilience to the harsh conditions of living on the streets. They are also become prone to abuse, sexual abuse, violence, and all those kind of things that can happen on the streets. So homelessness or unstable housing situations are strongly linked to mental health challenges. Hence, the need for housing policies that promote affordable housing, prevent evictions, or support homeless people, and can greatly improve mental well-being. So when addressing issues to do with mental health, when you have clients with mental health, we also have to look at such issues of where they live. Sometimes they might not be living in the streets, but the houses or the accommodation that they live in might not be very proper for people to be living under. So we need to refer to the housing policies to see how these people can be accommodated in proper housing. Then also education policies. I'm sure most of the countries have education policies. We also have global commitments, and we have global organizations that actually fight for issues to do with education, like UNICEF and World Vision. We have many organizations that are assisting governments in implementing education policies, as these promote equity and education open doors for other opportunities in life. Mental health education can help reduce stigma and support early intervention. I've also realized that school often plays a role in early detection of mental health issues. Sometimes parents, because they lack the know-how and the expertise, they might not notice that their child have a problem, a mental health problem, but this might be detected as they go to school, and some of these cases might be reversible if they are treated in their onset or in their early stages. So education policies also help in preventing or quickly addressing mental health issues that may be affecting the children in their early stages. Then we also have discrimination and social justice. Anti-discrimination laws and policies promote social inclusion and protect the marginalized. I've already discussed about how social inclusion can adversely affect mental health. We have marginalized and vulnerable groups that are not usually excluded in communities. People like the orphans and vulnerable children. We have the disabled, the elderly, some women, especially those who are single or widowed. They are normally excluded in communities, and this increases this put them at the risk of mental health. And now we have the issue of diversity, inclusion, and equity. This is trying to rope in to make sure that everyone is included in development, and this will help in curbing mental health issues. There are plenty of other social policies, but I cannot exhaust the whole list of policies. You can read more on other policies that addresses social determinants that affect mental health. So in conclusion, I can just run down through the relationship between mental health and social policy, or how social policies, the role it plays in mental health. So mental health, as we have already discussed, is profoundly influenced by social health determinants, and social policies play a critical role in mitigating risks associated with poor mental health. Policymakers should recognize the link of these domains to effectively address and improve mental health outcomes across populations. By implementing inclusive social policies, significant positive impacts on mental well-being of individuals, especially the marginalized, can be achieved. Moreover, social policies regarding mental health must be comprehensive, inclusive, and sensitive to the unique needs of a specific and various population groups. And then finally, is the landscape of mental health continually evolve, particularly in response to global challenges such as COVID-19. There is need for ongoing assessment and refining of these policies, so that it remains essential to promoting mental health. That this is the end of my presentation. Thank you.